Hi, if you don't already know me, I'm Amber. I'm the Safety and Training Officer for the city. I wanted to send out a message to employees today because I have something that I want to talk about. I know you all know about COVID-19 and how to avoid transmission. The reason that I'm sending this video out today is that the degree of hazard to employees right now is quite a bit higher than it has been in the previous 7 months of the pandemic. I think if you know me or you've ever been to any of my trainings, you know that I'm never out to scare anyone. That's not my thing. Some safety people think that works, but I think it's really emotionally not good for people. And especially right now, folks don't need another emotional stressor. So my whole purpose is to help people get smarter about risks and behave accordingly. So I want people to wear hard hats to protect their heads and their lives, not because their supervisor is going to write them up for not wearing it. Verifiable information is my teaching tool of choice, always. That being said, I wanted to give you some of this verifiable information in order to illustrate to you how the degree of risk in our area, as well as in our work groups, has increased over the past month, and how we really need to respond to it in order to reduce the risk to everybody. Both the people we work with every day and the folks that we're connected with at home, our friends, our family, our loved ones, etc. So the first piece of information I have for you is that over the weekend, Minnesota hit 2 record days of new cases, both exceeding 3,000 new cases in a day. It's a lot of new cases for a state in a single day. We had 2 of those. Second, the stat that I really pay attention to is the number of active cases, because you could have a boatload of cumulative cases and 0 active cases, and for all intents and purposes, that would be a really good thing. Unfortunately, the number of active cases in Minnesota has more than doubled over the past month, from a little over 8,100 to over 18,000 in just 1 month. The third piece of information I have for you is that the number of active cases in St. Louis County has gone up by more than 50% over the last month, and Douglas County's active cases have more than doubled in the last month as well. Fourth, the number of positive cases in city employee work groups within the month of October was 14, and now that it's November, it's continuing to go up. 14, that's twice the number of cases we had in March through September combined. So lastly, I want to just kind of touch on fatality rates, because this is often a point of discussion. Fatality rates have trended downwards since testing has become more available, which is a good thing. There are specific groups of people that are much more susceptible to COVID-19 than your average 20 to 30 something employee. Not that most of you are 20 to 30 something, that's just an example. The CD states, as of today, which is November 3rd, that fatality rates for this infection are 90 times higher for people ages 65 through 74, that's my mom's age, than for folks in their 20s. For people 75 to 84, that's my dad's age. Their fatality rates are 220 times higher than for folks in their 20s. For our beloved people who are 85 and over, their fatality rate from COVID-19 is 630 times higher than for people in their 20s. In fact, in Minnesota, the fatality rate of our grandmas and grandpas over the age of 84 is more than 1 in 4. 1 in 4 in this age range who get COVID die from it. So those are all verifiable statistics from the Minnesota Department of Health, the CDC. Now that I have them out of the way, I want to talk about how we work together. I do assessments on all kinds of hazards, from chemical hazards to crush hazards to fall hazards. I feel that you can make nearly every job safe. You can manage your risks. You can make nearly every job safe if you identify the hazards and find a way to eliminate or mitigate them. Same with infectious disease. If you eliminate transmission pathways, you eliminate the risk. And kind of right now, our biggest risk in working with each other right now in regards to transmission is when we get close to each other. If you're sharing a breathing zone with someone else, you may inhale their exhaled moisture particles. If you stay 6 feet apart or more, your breathing zones really don't overlap. Well, they do maybe a little bit, which is why it's very important to wear masks as well. Even if you're in common indoor spaces with others like break rooms, hallways, bathrooms, or the copy machine area, if you're 6 feet apart, you should also be wearing a mask as well. Indoors. Out of doors, if you're within 6 feet of other people, you should be wearing a mask as well. If you're 6 feet apart or greater outdoors, you probably don't need the mask. Just because there's a lot of air dilution that happens outside that dilutes any particles that are coming out of you and other people. So wearing a mask just helps to reduce the spread of moisture particles, and it mitigates the risk of potential contamination and transmission to your coworkers. By the way, always feel free to contact either myself or Safety Steve down at Public Works for extra masks. We have a bunch, so if you need more, let us know. Fomite transmission, which is the touching of things that other people have touched. It does pose a bit of a risk to us and others as well, which is why we should wash our hands often so germs aren't hitching a ride on our hands until we touch our eyes, nose, or mouth and infect ourselves. Touching our eyes, nose, or mouth with germs on them just grants those germs full access to our mucous membranes, and then they get into our system and cause us infection, which is, the same transmission route as you get for colds and flus, but of course, COVID-19 as well. And I know you all know these prevention measures. Keep 6 feet apart, with or without masks. Wash your hands frequently. Don't touch your eyes, nose, or mouth without washing or sanitizing your hands before or after. You know all this stuff. But I want to make it clear to you now that right now is absolutely the wrong time to get lazy about it. It is the wrong time to take outside social risks like having your annual knitting party or doing your annual lutefisk feed or just having friends over casually if they aren't distanced and outdoors or wearing masks and distanced indoors. Right now is not the time to get lazy about this stuff, and it is not the time to take extra risk. And the reason is because we have a lot more cases in our state, in our county, in our city, in our work groups. If you do feel like you're getting sick, contact your supervisor and go get tested. You can do the saliva test down at the deck Wednesday through Sunday, and results are coming back generally within a day and a half. If you have kids that need testing, I highly recommend the saliva tests over the traditional nasal swab. You can get your test through Essentia, which is up at, they do that at the old Sears drive-through in the mall. There's even rapid testing over at MedExpress and Cloquet, which has a 15-minute turnaround time for results, but they're kind of hard to book. They're kind of busy. So if you have close contact with someone who tests positive for COVID, you have to quarantine for 14 days from your last day of contact. Now let me define that for you. Close contact is not defined as being in the same room as someone. It's not being in the same grocery store or Menards as someone. It is being within 6 feet of someone with or without masks for 15 minutes or more, which is cumulative over a 24-hour period. That's new in the latter part of October. So a cumulative 24-hour period if you're within 6 feet of someone for 15 minutes or more. So it could be a 15-minute stretch of you being within 6 feet of someone. It could be, 10 minutes now, 5 minutes later, as long as it's in that 24-hour stretch. It could be 3 stints of 5 minutes, and on. If it's 15 minutes cumulative over the course of 24 hours that you're within 6 feet of someone, that is considered close contact. Close contact also occurs if you cared for someone with COVID, you touched or hugged them, you got respiratory droplets on you, or you shared eating utensils with them. Close contact is close. which is why you should always be distanced from each other at work whenever possible. That way, if one person gets COVID, we don't have 9 other people that go out on precautionary quarantine because they were all working in close quarters together. Stay distanced from each other. That is employees' obligation right now for public health, for employee, cumulative health. Okay, back to quarantine protocol. If you had close contact with someone who tested positive for COVID, you can get tested during that 14-day quarantine. Feel free, but a lot of times if you're not showing symptoms yet, you'll probably test negative, even if you've been infected. The virus, as far as we know, we know some things about it, not a ton of things. The virus, as far as we know, has about a 2 to 12-day incubation period, depending on the person. So if you get tested on day 3 or 5, you probably will test negative. You may not even test positive until day 12 if you got infected. As far as we know, in typical symptomatic cases, people really start to be infectious to others about 48 hours before they start showing symptoms. So back to the distancing and masks topic. I recognize that it is sometimes annoying to do the things that mitigate transmission, but it really is the right thing to do right now. We've got methods to reduce the risk of spread in the workplace. We stack them on top of each other. They multiply in effectiveness for every one that you stack. You stack masks on top of distancing, on top of frequent hand washing, on top of don't touch your face. The risk decreases with every precaution. When you stack precautions, they multiply in effectiveness. And if people can do all of these things well and consistently, cases will decrease. We get COVID from one another. If there's no transmission route for that COVID because we are masked and distanced and we wash our hands and we don't touch our face, there's no mechanism for that transmission to happen. Or very, very, very limited. Though I do want to mention just that the majority of our COVID cases here at the city have not originated from workplace spread, but from outside social contacts. Please make a renewed effort to reduce the risk to yourself and others at work. Stagger your breaks if that helps. Distance yourselves. Wear your masks because it protects you and your coworkers and all of your beloved people, not because your boss is going to write you up for not wearing it, though they certainly can do that. We have hundreds of hardworking employees, and all of them have a nice Venn diagram, the circles that overlap each other. We have a Venn diagram of people that we interact with at work, at home, at leisure, and we not only need to protect our employees and our coworkers, but we need to work to protect their Venn diagram of beloved people. Some of us have people at home who are at higher risk. Some of us are caring for elderly parents. Some have folks at home who are in chemo. We need to protect each other, and not just each other, but our Venn diagram of beloveds. I'm a big fan of people. I like people, especially people I know. I want you all to last as long as possible, and I want your beloved people to do the same. So thank you for doing your part to help reduce the risk of your friends and coworkers at the city. I truly appreciate your efforts, especially now that our risks are increasing in this area. So thank you for watching out for each other. If you have any questions on COVID protocol, info can be found on the city website, both on the homepage and in the HR section. You can also always email or call me for additional info as well. If you have a really urgent concern or situation, you can even contact me after hours if you need to. My number is 218-349-8141. Thank you for listening, and have a safe day.